serving Long Island for over 80 years. Thank you for listening to the station that serves your community. AM 1240 WGBB.com and 1240 WGBB Freeport.
This is Healthy Living Radio with your host, Dr. David Scharf, a compelling program featuring today's top healthcare professionals. Join us as we explore the latest treatments and technologies to provide better care in today's ever-changing world of health and wellness. Now here's your host, Dr. David Scharf.
You're listening to Healthy Living Radio, dedicated to bringing you the latest advances in health and wellness so you can live better, healthier, and longer. Today's topic, how small changes in your smile can make a big difference. And our guest on tonight's show is Long Island's go-to guy for cosmetic dentistry, Dr. Gary Rosenfeld. Gary, welcome to the show.
Oh, thanks for having me, Dave. I really appreciate it.
It's a pleasure to have you. I know you, for those of our listeners who don't know, you practice in East Islip. How long have you been there?
13 years.
13 years.
Yes.
And where were you before that?
I was in New Jersey for, about 10, 15 years, and came back home. We grew up next town over, Islip, New York.
Is that right?
Yes.
Is that right?
Yeah.
How did you know you wanted to be a dentist? How old were you when you decided you wanted to be a dentist?
Oh, gosh. I was about 13, 14 when I wanted to be a dentist. So, the good that my dentist did, and, I really got interested in it. And, seeing him work with everybody really made an impact on me.
That's great. That's great. Well, let's just tell our listeners a little bit about where you went to school and some of your training. Where'd you go to college and dental school?
Well, I went to 4 years for college at Indiana University in good old Bloomington. Got a degree and came back with a wife.
And then where'd you go to dental school?
Oh, I'm sorry. Yeah, I went to dental school back home in New York, in Manhattan, at Columbia.
Uh-huh. And then after dental school, did you just go to practice, or what'd you do after that?
Well, we did a residency for a year on Staten Island at Seaview Hospital, and then after that, it was, started practicing, working for other people, and, improving the, my craft and, my abilities, and then eventually wound up going on my own.
Mm-hmm. And, for our listeners who don't know, Dr. Rosenfeld just recently built a beautiful office right in East Islip. How are you enjoying that office?
Oh, it's wonderful. Everybody's been so great in the community. That building came out terrific, and it's just an asset to the to all of Main Street.
Yeah, it is beautiful. I've driven by, and if you haven't driven by, it's the nicest building in East Islip by far. It's beautiful. So if you don't know where it is, people should stop by. So we're going to talk about cosmetic dentistry tonight a little bit, and I know your practice. You have a family practice. You don't just specialize in cosmetic dentistry.
That's
right?
correct. We take people of all ages, and if you have teeth or need teeth, we're there for you.
Yeah. So who's the typical patient that comes in for cosmetic dentistry?
The typical patient is basically somebody that either their child is getting married, or they're expecting a function to go to, or somebody actually looking for a job. That's a big market now.
Is that right?
Well, but the way the economy is, it's tough getting jobs out there. You need every advantage you can get, and employers are looking at the whole package. They want to see you. Well, if you're dealing with the public, especially, you want to have a nice smile.
Have you had any patients come in who were unemployed, fixed their smile, then went out and got their dream job?
Oh, absolutely. It happens quite often, as a matter of fact. Recently we had somebody that, she got laid off, and she said, I need to do something with my smile. And she was interviewing, and we fixed her up with a set of laminates veneers on her teeth, fixed up her smile, brightened it up, and she looks beautiful now. I was able to get the job.
You'd think in this economy maybe people would feel guilty about fixing their teeth, spending the money on that, but it sounds like a lot of people come with the mindset that it's more of an investment than a luxury.
Absolutely. In order to get a job, you really have to, today especially, jobs are at a premium. You have to, be able to look the part,
Is the typical patient you see for cosmetic dentistry someone who's, hasn't been to the dentist in 20 years, goes to the dentist all the time and just wants a little touch-up? Who's the typical person that you see? Is there a typical person?
Well, not necessarily. It could be anybody. It could be someone who hasn't been in there for 20 years. It could be somebody who goes regularly and just wants something done with their smile, to make it look better. Whether it's to whiten the teeth, which is a big market today. Something that's really popular today are the no, as you would say, no drilling veneers too. We're doing a lot of those today also.
What are those? You hear about those advertised, no drilling veneers or no prep veneers.
Well, it's not necessarily for everybody. I want to put that disclaimer out there right off the bat. And it's just basically what it says. It's a porcelain covering, goes right over your teeth. No preparation is necessary. You don't have to leave the office with temporaries. So the next time we're not, having a difficult time removing the temporaries or anything like that, we take what they call an impression, send it to the lab, and 2 weeks later, your veneers are ready to be placed.
No Novocaine.
No Novocaine. I'm sorry, you're right. That's another good point too.
People must love that.
Oh, they find it terrific. And it's all it's all over the media today too.
Yeah. Mm-hmm. When you get somebody in who wants to do an enhancement, first, what would you say is the most common cosmetic dental procedure you do in your office these days?
Most common one is probably all porcelain crowns.
And what are those for? Tell me what an old porcelain crown is and why somebody would have that.
I'm sure the old term was cap. People have huge holes in their teeth. They have huge fillings in their teeth that have just gotten ugly and discolored over time. And what we do is we place the caps over the teeth. So that they're there to get you a nice white smile, get the teeth nice and straight, and they'll last a pretty long time.
And we were talking before the show a little bit about new technology in caps, and the old caps. Well, maybe you could tell us what the difference is between the old style caps that were used years ago and that some people still use, and really the state of the art caps like you were just talking about that you use.
Well, that's pretty much the way it was. That was the standard of care back then.
What was it?
I was just going to get to that. It was metal and porcelain over it. And the problem with that is as your grandmothers probably all had, was that gray line right at the gum line. And they just looked horrible, And the reason for that gray line is you don't have porcelain, sitting there at the gum line. And that's really the whole thing. So to get around that problem, we now do all porcelain crowns. Today, they're actually computer generated. Most of them. So it's it's even more technologically advanced.
It's almost like a perfect fit.
Absolutely.
So why doesn't every dentist do those type of all porcelain crowns now?
Well, there is a level of comfort. Some people don't feel comfortable with that. Some people really are not up on it. And some people, some dentists, they're not. They've been around. They're set in their ways, and they don't. They don't want to change or don't feel it's necessary to change.
So you've been practicing many years. How did you make that jump? How do you manage to decide, okay, this is the old technology, I'm going to move on to the new technology? How do you keep up with the education and the training?
Well, I take a lot of continuing education, a lot of classes on that, and over the years of seeing different lecturers in different parts of the country, that's how I've gotten all the training and the necessary information, to make that change.
Now, you see a lot of stuff, you turn on the TV, you see all kinds of things about bleaching and white strips and all kinds of fancy stuff like that. Why would somebody come to the dentist to have their teeth bleached as opposed to using an over-the-counter product?
Come to the dentist to have the problem with over-the-counter products is by law they're not strong enough. Okay, so and also the toothpaste. When you brush with the toothpaste, you're not keeping the material in the area long enough. So you really need to go to the come to the dentist to get a higher strength of the whitening product. As well as keep it in the area, whether it be by trays or Zoom, or even now we have deep bleaching, that's specialized trays that even goes many steps beyond the Zoom. Mm-hmm.
So when someone comes, can bleaching help everyone's teeth look bright and white and perfect, just like they want, or are there limitations to that?
The limitations on the bleaching is they won't whiten. whiten fillings, and they won't whiten crowns or anything like that. If you have a situation like that, you really need to get porcelain on them.
Mm-hmm. Okay, we're going to take a fast break. We're talking with Dr. Gary Rosenfeld, cosmetic dentist in East Islip, New York. We'll be right back.
This is Healthy Living Radio with Dr. David Scharf.
Okay, we're back talking with Dr. Rosenfeld on cosmetic dentistry. What would you say is the spectrum of people coming in? I mean, are all these cosmetic cases big cosmetic cases? Do you ever get somebody that maybe their teeth really doesn't look so bad, but they just want a little touch-up?
Absolutely. It goes everywhere from a full mouth full of porcelain to maybe even just one tooth to maybe even just a simple bonding case. Mm-hmm. Or perhaps even as we discussed before, whitening.
Mm-hmm. You know, when we started talking today, you were saying that, some of the patients you see are people that haven't been to the dentist in 20 years. And why do you think that is? Why do you think that somebody stays away from the dentist for 20 years? What's been your observations?
Oh, it's one of three things. It's time, it's fear, and it's cost. Today, really most of those excuses are gone. Things are now made more affordable with even outside financing. Time, we've certainly got evening hours, Saturday hours. It's very convenient, so you don't have to take off from work. You don't have to take your kids out of school. We have all these evening hours for you. Today, things like Novocaine and nitrous oxide, it really makes the visit a lot more comfortable than it used to be. Plus, the technology of the dental instruments itself has so far improved that it's really a much more pleasurable experience than it used to be.
So the memory that people have in their mind of what it was like 20 or 30 years ago, that's not the reality today.
Oh, no, certainly not. Those days are long gone.
What ultimately you think, when you have someone that hasn't been in 20 years, gets them to pick up the phone and do something?
Oh, what?
Aside from their wife.
Oh, well, that's always the number one problem, Well, either they look at themselves in the mirror, they get tired of looking at themselves in the mirror. That's a big issue.
Yeah.
Obviously, if someone's in pain, well, of course they're gonna pick up the phone. Nobody wants to be in pain, And but those are the big issues,
How do most patients find your practice? How do most patients come to you?
Oh, we're on the internet, word of mouth. We've got a huge presence in the community. I'm a member of two or three community organizations. So we're out there. And we take very good care of people. I have to tell you that. Staff is very attentive to their needs, and we make them very, very comfortable.
If someone's listening to the show, and I'm sure people are that have been thinking about doing something with their smile or some kind of cosmetic dentistry, and let's say you just met them at a cocktail party and they said, Gary, how should I go about finding a cosmetic dentist? Everybody, you drive up and down the street, every sign says cosmetic dentistry. First, is there a specialty in cosmetic dentistry? Is that a recognized specialty, or how does that work?
No, everybody could do cosmetic dentistry. Okay, There's no specialty per se. But if you're looking for a cosmetic dentist, the best way is pretty much go on their website, see their work, see what kind of training they had, and those are the important things.
Is it appropriate for someone to come ask the dentist and say, let me see your befores and after, show me some of the work that you've done? Should someone be uncomfortable doing that?
No, absolutely. You should certainly ask to see that. As a matter of fact, the dentist should volunteer to show you the before and after pictures. Mm-hmm. How else are you going to tell whether the work is for you, basically?
When you have somebody comes in and they say, look, I hate my smile. I mean, probably some people are very specific. I hate this chip or I hate this spot. But probably some people just say, I hate my smile. I want you to fix it. How do you go about determining what you think is going to make them happy and making them happy?
Well, we take photographs, we take study models, we show the photographs on the screen in front of them, and we go over tooth by tooth how it could, with the models, how it could make their smile better. That's really the main thing,
And do people usually have options, or is it usually, one way to really fix the problem?
Well, there's always an option, but, obviously, as with anything else, certain options are always better than others,
And you mentioned before when we were talking about people that come in for this kind of dentistry, the mom whose daughter's getting married or a person looking for a job. A lot of people have in their mind that cosmetic dentistry is either frivolous or really beyond the affordability of the average Joe, that it's, the supermodels or the wealthy people that have cosmetic dentistry. Has that been your experience, or is it sort of the average person that has cosmetic dentistry?
Average person. Anybody can get cosmetic dentistry. Today, like I said before, there's third-party financing through many companies that it's really it's taken the lack of affordability out of it, okay? It's really shouldn't be the excuse it used to be, and it's for a couple of $100 a month, $100 to $200 a month. It's really easy to do.
That's it. Somebody can have a new smile for a couple. That's their cell phone bill, or maybe their cable TV or their cigarettes. What they spend a month on those things.
You betcha.
That's amazing.
Absolutely.
Now, we were talking a little bit before also about sort of permanent bleaching. That you were saying before that that when people have laminates, that they're white for life, as opposed to when they bleach their teeth, it's maybe not as permanent. Can you explain that a little bit to me some more?
The beauty of porcelain is it will always hold its color. It will never change. It will never darken. Okay, as opposed to your bondings, which they are very porous material and they do tend to darken over time. Today, you've got a billion-dollar industry based on whitening products, and we can get you as white as you want. And incidentally, that's pretty much what people want today. When I was in dental school and stuff like that, everybody wanted that natural look. Now everybody wants that white look. And I've got patients, and they come in and they want that. They come in, well, we're going to go natural, and we show them what white could look like, and they love it when those veneers and those laminates are placed.
Yeah.
Absolutely.
So how long should someone expect laminates to last?
Well, if you keep them clean, keep up with your hygiene visits, there's no reason why they shouldn't really last forever.
Yeah.
Yeah.
Do they ever pop off or chip or break like that?
I'm not going to lie to you. That could happen. Mm-hmm. If they're intact, it's real easy to re-cement them. It's not that big a problem. No, absolutely not. If they're not intact, well, by golly, get a new one.
And when someone has one pop off, can you just replace that one, or do they all have to be replaced?
No. It's you could just replace the one. You don't have to replace all of them.
So if somebody wants laminates and they, do they have to limit their diet? Can they enjoy spare ribs or chicken or apples or those kinds of foods?
For the most part, none of that's a problem. Okay, you should be able to eat and certainly smile with the best of them.
Is that right?
Yeah, absolutely.
That's unbelievable. So no limitations. What kind of I haven't seen them lately, but when they had the makeover shows on television?
Oh, yes.
And, they would take, like, the quiet librarian, they would fix her teeth, and she'd become, the wild, she'd become Oprah on television. Have you ever really seen people whose personalities change once they fix their teeth? Is that just a lot of hooey, what you see on TV?
No, that is absolutely true. People do become more outgoing and more confident than before, after you fix their teeth. Absolutely.
Do they tell you that, or do you just see it?
No, you can see it.
How
you
so?
can see it. Well, they come back to the office for hygiene visits, let's say, and they're like I said, they're more outgoing. They want to show their billboard smile, and they're always coming in. I'm flashing my smile around town and showing your fine work, and you see a huge difference after the laminates are in.
Do you see like new clothes, new hairdo, color the hair,
sometimes
lose 10 pounds, the whole thing?
Sometimes that does happen.
Yeah, I bet you get a lot of letters. I bet of all the things you do, it's one of the most satisfying.
Oh, without a doubt, because that's the biggest change. That's the one you see the most. Mm-hmm. You're not really necessarily. I mean, you feel when you're taking somebody a pain. Obviously, you feel a lot better. But the change you see the most is obviously in the front. There's no doubt about it.
What kind of stories do people tell you? You do a laminate case on them. You see them 6 months later, and they come back. I'm sure they tell you about how they feel about the cases. What kind of stories do they tell you when you see them, months later, with their new teeth now?
Oh, with their new teeth. Everything from new job, new boyfriend, new girlfriend, new wife, new husband.
Or all four at the same time.
Yes, that's always possible.
That's exciting. That's got to be a really good feeling.
Absolutely.
It sounds like a lot of these cases are challenging. These cosmetic cases can be, a real challenge to unravel and get into.
Sometimes they can. You have to use a lot of thought to it. Mm-hmm. Absolutely. And you work, hand in hand with the laboratory to get it done, and with the patient. And let's face it, the patient wants certain criteria, certain needs that they're looking for.
How do you find that out? How do you find out what the patient wants?
They'll tell you. You ask them, they'll tell you.
Yeah. Is there a lot of back and forth? In other words, is there a lot of give and take during the planning process?
Of course. Every step of the way, the patient has to really be informed and, take a good look at everything.
So how do you know when you make a laminate case that when it goes in that the patient's going to love it? How do you know before you do it and they're in that they're going to be happy?
Before it's cemented finally?
Yeah.
Well, we always try it in first. That's why they make try-in paste.
Yeah.
Oh, yeah. Nothing gets cemented at all in the office without the patient seeing it first. Because if it has to go back to the lab, it's a lot easier to do it before it's cemented than after.
So you can try it in. They can take a mirror, see what they look like,
yes,
and know it's too light. It's not light enough.
Yes.
I want it round, square. I want Julia Roberts' teeth, or anything like that.
Yes, sometimes that happens. And people have, like I said, people have different preferences to what they're looking for. We don't want to impose our will on everything, so they're looking for whatever they want, and we try to make everybody comfortable and everybody happy, and it works out great.
Is it common for people to bring somebody else to those visits, a husband, a spouse, to say, hey, what do you think of these, or do they usually do it by themselves?
That's a good question. It's about half and half. Sometimes they'll bring their spouses for moral support, but many times people know what they want, and they just do it, wing it themselves, and there's no need to have a spouse or anybody there, really.
Can you guide people? I mean, if people aren't sure, can you sort of guide them which way they should go? Or
absolutely, we do that all the time. And the biggest thing is mostly with color, okay? And that's what I alluded to before. I tell stories about people who, to other patients coming in, how people came in, wanting a darker color, let's say, or a more natural color, and we discussed about having ultra white teeth, which today is what people want, and how they all loved them. We just suggest that. Now I show them the different shades that are possible, and basically, let's face it, if you're doing everything, a whole laminate case. Whatever, it really, dentally it doesn't matter, but whatever shade you're comfortable with is really, what we can accommodate you with.
When someone's doing laminates, how many do they have to do? Do they have to do 2, 4, 6, top, bottom?
Well, they could do any number. That's up to them. I have done one. I've done from everything from 1 to 18. So, and beyond. So it really depends on the patient, but yeah, I mean, if you're going to do if you really want to do a cosmetic case, you at least have to do 8 per 8 for the top and 8 for the bottom. Mm-hmm. That's really what you have to do. If you don't do that, you're going to get a sunken in look, and it's going to look like shadows. So it's really important that really, if you want to do it upright, you really should do 8.
Because it'll be dark in the back, you're saying. Light in the front, dark in the back. The back will disappear.
Yes, and then you have that eye tooth, as they say, or the tooth in the fang, whatever word you want to use for it. And that's always darker than the rest of the teeth. So you kind of really want to cover that. And if you cover that, and the one behind it, as you said, Dave, is going to look in the shadows and darkened. Mm-hmm. So you really want to take care of that.
And does someone have to commit to that up front? In other words, can they say, well, I want to do 6 now, and then maybe I'll see, can I do more later on? Or is it all or nothing in the beginning?
If you're doing it just to whiten the teeth, you probably can get away with that. If you're having a problem with teeth being crowded and crooked, and you want to get space, you want to rob Paul to pay Peter, let's say, you really have to do all 8 up front. Otherwise, you're really going to have it. You really can't take full advantage of taking care of that spacing problem.
So the laminates are more than just lighter. In other words, you said if their spaces are twisted. So if someone has spaces between their teeth, or the teeth are turned, they don't necessarily need braces to have them have that Hollywood smile that they want.
No, we could do that in 2 visits, basically.
Is that what they call instant orthodontics? You hear people talk about?
That's about right, yes.
So they don't necessarily need the braces and the wires and 2 years worth of that stuff.
Not only are you getting them straightened, but you could also get them whitened at the same time, and whitened forever at the same time.
Mm-hmm. When what do you think is the biggest barrier? Because, I mean, really, when you think about it, who doesn't want to look their best nowadays? Really, most people realize the importance of looking your best, being healthy and being reasonably presentable. What do you think is the biggest barrier people face? I mean, honestly, I'll tell you, the biggest barrier people face is usually cost. Mm-hmm. I'll be honest with you. But do you think does reality match their fear? In other words, if they're thinking that I just can never afford this, do you find that when people finally come in and see what it's going to cost, that they're surprised to find out that it's affordable, that what they thought was keeping them away really doesn't hold water? Oh, absolutely. Once they come in, we work with them, and like I said, there are ways to finance it, so it's only down to like $100 to $200 a month, and it's today it's very affordable. It's funny when you get to numbers that are in that range. 5 years ago, nobody had an iPhone. And if you said to somebody, look, you need to spend $100 a month for dentistry, people say, I don't have $100 a month to spend for dentistry. And now everybody has an iPhone. They're spending an extra $100 a month for their iPhone. The money magically appeared, So it's sort of funny how it's almost more psychological than anything else. Much of it is. You're right. And there's the other factors, fear and time. But like I said, today there's things are not like it used to be. It's certainly easily to do, and especially with no preparation or the trademark name Lumineers. Mm-hmm. With that, there's no discomfort at all to that. So let's say someone's listening at home and they kind of want to get started. What should they expect the process to be? They call you up, they talk to you, they meet you. How's the process work? Well, the first thing is the phone call, isn't it? You got to call the office. That's the first thing, and get you in, do a comprehensive, look at everything in your mouth, do a smile evaluation, and we'll show you the pictures on the screen. We take the models, we show you how your teeth come together, and, that's really the starting point. So there's plenty of time to talk and get to know you and get comfortable. Oh, sure. One last thing, then we have to wrap up. But, word around town is that you're especially good with anxious patients. So what is it you do that helps the anxious person, be so comfortable? Talking calming tones. That's the big thing. Make everybody feel comfortable in the office. And that's really the main thing. Tell them reassurance. Staff is great at that. We're all very good at reassuring everybody and making them feel comfortable. Mm-hmm. And we have a very overly friendly staff. Yeah. How long have most of your staff members been with you? Oh, gosh. Ranges from all 13 years to within the last year. Is that right? It's, It's probably a nice comfort to patients to see that same face for 13 years, other than your face, to see a different face. That's a more attractive face, yes. That's great. Oh, we're adding staff all the time. Yeah. I bet you have a hard time finding people of the caliber that you usually have in your office, because I know they're all terrific. I appreciate that. Thank you very much. So let's talk a little bit about just how people can reach you. So what's your phone number if somebody's listening and they want to call in? Oh, it's 631-581-8600. Mm-hmm. And you can catch us on East Islip dentalcare.com. Mm-hmm. And where's your office in East Islip? It's right on Main Street. If you know East Islip, it's right conveniently located right next to Carvel. So it's right in the middle of town. Mm-hmm. And are most of your patients from East Islip? I know you're by Great River. It's mostly from let's say from Sayville to West Islip. Yeah, that's really, and it goes up. We go up to Brentwood and Central Islip. So it's really that general area. But I've got people from Manhattan coming in. Absolutely. And lastly, is this cosmetic dentistry just for young people, or what's the oldest person you ever did cosmetic dentistry on? Oh, gosh. She was in her 90s. Is that right? Yeah. And how did that come about? She wanted the whitest, the whitest color possible one day. And she did have crooked teeth. Mm-hmm. So we fixed them up, gave her a nice white smile, and she's thrilled as anything today. That's amazing. Yeah. I bet she felt like she was 30 again. Mm-hmm. And had that been something she always wanted to do her whole life for years and years, and she finally got to it? She finally took care of herself after taking care of everybody else. Yeah. What did her family think? They thought it was terrific. Yeah. They saw a world of difference, and they were happy, all for it. I tell you, always have to respect someone at any age that decides to take care of themselves, that wants to put their best foot forward, to look their best, and then, ultimately to feel their best. Absolutely. But that's got to be very satisfying. Yes. And what's the youngest one you ever treated? Oh, the youngest one?
Oh, gosh, early 20s.
Is that right?
Basically. Yeah. If you get too young, you're really not a candidate for veneers too young.
Yeah.
You know.
But I would guess if somebody chips a tooth or a kid has a little snaggle or something like that, you can just smooth it off and make it look better.
There are many options. Smoothing off and is one, but full veneer case, you got to be a little older for that. But yeah, there are many options for teeth that are really in disarray and disrepaired.
So I guess the bottom line is you just got to pick up the phone call you, get started, take that first step, and at least find out what can be done.
That is how it starts.
That sounds great. Well, I want to thank you for being on the show tonight.
Thank you for having me.
I knew it was going to be a great show, and you didn't disappoint. I want to thank everybody for listening. I'm Dr. David Scharf. You've been listening to Healthy Living Radio. See you next week.
Dr. David Scharf. Join us next week for another edition of Healthy Living Radio.